Cumberland County Schools Return to Learn Concussion Policy 4270-6145. A brain injury that is either caused when the head suffers a severe blow or when the body is shaken and the brain is jostled as a result. There are several support services available. Response to Intervention Protocol, RTI, will be the first we discuss. An RTI may be used for students who need academic adjustments for an extended period and or need to increase the level of a particular intervention. An RTI allows for a multi-step, targeted approach that school professionals can use to monitor a student's progress through increasing levels of an intervention. At each intervention level, a school professional assesses the students to determine whether additional instruction or support is needed. 504 Plan. Students with persistent symptoms and who require assistance to be able to participate fully in school may be candidates for a 504 plan. A 504 plan will describe modifications and accommodations to help a student return to pre-concussion performance levels. For example, a student recovering from a concussion might receive environmental adaptations, temporary curriculum modifications, and behavioral strategies. An individual education plan, IEP. Students with certain classifications of disability that adversely impact educational performance may be eligible for an IEP. These students generally require significant help to assess the curriculum. This help may include adjusting the student's workload, adjusting methods or pace of instruction, or allowing the student to work in an environment other than an inclusive classroom. The majority of students with a concussion will not require an IEP. However, a small percentage of students with more chronic cognitive or emotional disabilities may require this level of support. Return to Learn Notification. Upon notification from athletic director, physical educator, or staff that a head injury is suspected, the Return to Learn case manager should immediately contact the parent guardian, teachers, school nurse, and student services team. A care plan should be developed that identifies the Return to Learn case manager, informs of the suspected confirmed head injury, best practices for managing symptoms, accommodations, modifications, physician recommendations, and who to direct additional questions or concerns. Care plans should be reviewed weekly, and if problems persist beyond 2 weeks, the SST should meet to discuss next steps. A licensed healthcare professional should evaluate when it's safe to return to school, as well as recommend appropriate levels of cognitive and physical activity throughout the healing process. The following people should collaborate and provide support to the returning student. The health services team, which may consist of school nurse, athletic trainer, coach, and physical education teacher. Student services team, counselor, school psychologist, speech pathologist, social worker, school administrator, and Return to Learn case manager. Medical provider, emergency department, clinical psychologist, athletic trainer, and family physician. Family, student, and parent guardian. Signs and symptoms of concussion that may be observed by parents and guardians. Student may appear dazed or stunned, confused about events, answer questions slowly, repeat questions, can't recall events prior to the hit, bump, or fall, can't recall events after the hit, bump, or fall, loses consciousness even if it's for a brief moment, shows behavior or personality changes, forgets class schedule or assignments. Now, here are some physical signs and symptoms associated with concussion. Nausea, blurred vision, sensitivity to light, ringing in the ears, a headache and sensitivity to noise. Following a serious head trauma, it is common for the pupils, either one pupil on the side of the head affected or both pupils, to appear dilated or unusually large. If you can see the area where the head suffered impact, you may notice a large swollen bump or even bruising where the trauma took place. Slurred speech may be a symptom because a concussion sends the brain into a spinning motion. Normal speech patterns often sound slurred, incomprehensible, or the student may have difficulty speaking. cognitive function signs and symptoms of a concussion: lack of focus, slow decision making, inability to recall information, or unable to read aloud and or comprehend. Signs and symptoms that for coordination: dizziness, difficulty staying balanced, trouble standing up and walking in a straight line, vertigo. Some people experience this as a sense of spinning or dizziness for days, weeks, or even months after a brain injury. Emotional signs and symptoms: easily irritated and or upset, extreme mood swings, depression, anxious, nervousness. Sleep patterns: may have trouble falling asleep, increased sleeping, an altered sleep schedule, or drowsy. Now, what impact can concussions have on school performance? Slower reading, slower to learn new concepts, lapse in short-term memory, reduced or impaired concentration, difficulty with reading comprehension, more difficulty in planning, organizing, and completing assignments. Now, here's some strategies for addressing symptoms at school for cognitive. We want to concentrate first on general cognitive skills such as flexible thinking, organization, rather than academic content. Focus on what the student does well and expand the curriculum to more challenging content as concussion symptoms subside. Adjust the student's schedule as needed to avoid fatigue. You may shorten the day time most challenging when classes most challenging classes with time when the student is most alert. You want to allow for rest breaks and reduce their course load. Adjust the learning environment to reduce identified distractions or protect the student from irritations such as too bright light or loud noises. We also consider using self-paced, computer-assisted, or audio learning systems for the student having reading comprehension problems. Allow extra time for tests or in-class assignment completion. Help the student create a list of tasks and or daily organizer. Assign a peer to take notes for the student. Allow the student to record classes. Increase repetition in assignments to reinforce learning. Break assignments down into smaller chunks and offer recognition cues. Provide alternate methods for the student to demonstrate mastery, such as multiple choice or allowing for spoken responses to questions rather than long essay responses. Strategies for addressing symptoms at school: behavioral, social, emotional. If the student is frustrated with failure in one area, redirect him or her to other elements of the curriculum associated with success. Provide reinforcement for positive behavior as well as for academic achievements. Acknowledge and empathize with the student's sense of frustration, anger, or emotional outbursts by saying something like, "I know it must be hard dealing with some things right now." Provide structure and consistency. Make sure all teachers are using the same strategies. Remove a student from a problem situation but avoid characterizing it as a punishment and keep it as brief as possible. Establish a cooperative relationship with the student, engaging him or her in any decisions regarding schedule changes or task priority setting. Involve the family in any behavior management plan. Set reasonable expectations and arrange preferential seating, such as moving the student away from the window, bright light, away from talkative peers, or closer to the teacher. Now let's have we're going to do a few questions with Return to Learn. How does the educational plan of care translate to testing accommodations? Would we need a 504 for testing EOG exams? Answer: if a student needs accommodations for testing due to a concussion, the team may use a transitory impairment procedure. If a student sustains a concussion and symptoms last longer than the typical healing period of 1 to 3 weeks, should a 504 plan with appropriate accommodations be considered? At what point is it recommended to consider a 504 plan to meet the student's needs? Most students with a concussion will recover within the first 3 weeks. Due to the temporary nature of the concussions, a 504 plan usually is not warranted. Under Section 504 law, temporary or transitory impairments, typically 6 months or less, are not considered disabilities. However, When symptoms occur for prolonged periods of time, the following examples illustrate potential scenarios and decisions for teams. Prolonged symptoms occur in the supports outlined in the Return to Learn healthcare plan are proven successful in supporting those prolonged symptoms. The team may then decide student services team should meet to discuss other options and interventions. How does HIPAA impact the notification process? Are teachers really part of the medical team legally? Answer: HIPAA regulations are only applicable to actions completed by HIPAA subject agencies. In this situation, that would be the medical provider's office and would apply to their initial notification of designated school staff. The provider office is a HIPAA entity. The school is not. Schools are subject to FERPA requirements. Once the diagnosis and any related documents are in the school, they are defined as education records and subject to FERPA only. Under FERPA, authorities in the school district can disclose to anyone within the district on a need-to-know basis. That need to know is determined by the school nurse or Office of Health Services. Parent permission is not required to disclose within the school district. In addition, although some districts do not request parental signatures as a matter of policy, there is no requirement for parental consent to distribute healthcare plans and school staffs with a need to know. Teachers who work with students recovering from concussion are part of the school response team for that student. If parents indicate on the CCS Confidential School Health Form that their student has experienced a head injury, concussion in the past year, will there be some standard guidance on how to proceed, or will that be established in each LEA? If a parent indicates that their child has a sustained concussion, it's recommended that the Return to Learn case manager at the school be notified of this information so that they may follow up the parent in order to determine the next steps for that student. Since nurses cannot make diagnosis, wouldn't a diagnosis of head injury, concussion from a doctor be needed to activate the development of a care plan? That is correct. In some cases, there may be issues with the student getting medical care. The role of the school nurse is then to assist the parent in securing care if the student is experiencing symptoms. Let's check for understanding. What is a concussion? A, eye injury. B, brain injury that is either caused when the head suffers a severe blow or when the body is shaken and brain is jostled. C, broken leg. Good job, B. What are the support services available for students diagnosed with a concussion? A, 504 IEP and RTI. B, 504 and behavior intervention. C, IEP, RTI, and tutoring. Good job, A. How often should the Return to Learn health care plan be reviewed? A, annually. B, weekly. C, monthly. D, never. Good job, weekly. True or false? The following teams should collaborate and provide support to a returning student: health services team, student services team, medical provider, and family. True. Signs and symptoms parents may observe. A, dazed or stunned, silly, dizzy. B, can't recall prior to latter events, repeats questions, loses consciousness, forgets class schedule. C, increased hunger, irritable, slow to respond. D, none of the above. Good job, B. True or false? Cognitive functions that decrease when diagnosed with a concussion: lack of focus, slow decision making, inability to recall information, unable to read aloud or comprehend. True. The following impact school performance: A, slower to learn new concepts. B, difficulty planning, organizing, and completing assignments. C, slower reading. D, lapse in short-term memory. Or E, all of the above. Good job, E. Strategies for addressing symptoms of concussion at school: A, adjusting student schedule to avoid fatigue. B, allow extra time for testing and assignments. C, encourage long-term projects. D, A, and B. Good job, D. Which staff member is responsible for managing students diagnosed with a concussion? A, guidance counselor. B, principal. C, social worker. D, Return to Learn case manager. Good job, Return to Learn case manager. True or false? Providing a student with structure and consistency is a strategy for addressing behavioral symptoms at school. True. I challenge each of you to go back and make sure you know who your return to learn case manager is. You can check with your principal or assistant principal to see who's been designated, and we hope that we have a successful school year with no concussions. Thank you for joining me.